is all about making what it seems to be a straightforward decision, which actually really isn't a straightforward decision, or can definitely be convoluted for certain. So just kind of jumping into things, where I see problems is people not having a plan. That can be across, I think, the spectrum of medicine as a whole. Is we know the procedure, you know the book indications, but when it's now slapping you in the face, it can be pretty daunting to actually make that decision and do the procedure, whether that be intubation or like a crike. So what I'd really like to dig into that brain of yours is, what is your decision-making process? So I'm
going to preface this by explaining that chiefly most of my experience is working in a hospital, whether that's a small or large hospital. I spent most of my career in the largest private hospital in the state of Wisconsin, so we had a lot of very complicated cases, basically university hospital level care. With the complexity of the cases. Prior to the creation of Sugamidex, which reverses rocuronium, we would occasionally have to reintubate patients in the recovery room, recovering from anesthesia. It's a funny thing that when it was argued that the drug Sugamidex was adding to the pharmacy bill, but a $99 drug was solving a problem that required an $800 ventilator setup and basically had the patient undergo what we would normally call a near miss. These people, the reason you're rescuing a patient in a recovery room and reintubating them is that if you don't do it, they're going to die. You can't put a price on $100. $99, $100 doesn't mean anything in the scheme of things. If in the name of patient safety, we're not reintubating patients after surgery like we used to 15 years ago. So let's just talk about airway management emergencies that have nothing to do with muscle relaxants. Okay, so here's the thing. I'm an anesthesiologist.